Severe headaches and migraines can disrupt your daily life and make it difficult to perform simple tasks. In this sponsored segment, we are talking to Dr. Amit Masih, a neurologist at Memorial Healthcare Institute for Neuroscience, who specializes in the treatment of migraines. Good morning.
Good morning. Thanks for having me today.
Yeah, thanks for taking the time to come on today. First off, tell us a little bit about your experience working with headache medicine.
So I primarily deal with migraines, but there's lots of different types of headaches out there. There's cluster headache, chronic tension headache, as well as facial pain like trigeminal neuralgia. It can be very difficult and disabling for patients. I'm very fortunate to have trained under a very good place, U of M's Headache and Facial Pain Clinic. And now I practice at Owosso Memorial's Neuroscience Institute. And with the tools I've learned through training, I've been able to give my patients a lot more opportunities to get better with medications.
Yeah, that's encouraging to hear there. I mean, I know that headaches can impact so many aspects of people's lives, but particularly a lot of people have migraines. Can you kind of talk about, are there different types of migraines that people suffer from?
That's a very good question. So there are several different types of migraines. There's migraine with aura and migraine without aura. About 30% of the population will have an aura. An aura is just a neurological symptom with the migraine. Typically, an aura consists of visual disturbances. That's what most patients will say. And it's spots in their vision, or they're looking through they see blur, or looking through broken glass, kaleidoscope images. But people can also have stroke-like symptoms, such as numbness, tingling, weakness, which can be concerning. Of course, we try to rule out stroke in those patients. But if the patient has a severe headache that's sensitive to lights and sounds and have nausea with it, likely it's a migraine with that. But majority of patients don't have that aura, they'll just have a migraine. And regardless of whether it's migraine with aura or migraine without aura, we still treat the patients the same. We look at how frequent they have migraines, as well as the disability of their migraines as well too.
Yeah, so with all that said, what are some of those causes then of a migraine headache?
So migraines, it's not just one simple cause. There's a lot of different causes. First of all, what we do look for is a genetic component. So most patients do have family members, whether it be parents or indirect family members, such as aunts, uncles, even siblings might have migraines. But then we look at how is the social environment. Are they not sleeping well? Do they have depression, anxiety? Are they under a lot of stress? Food, hormones are also triggers for migraines. So we just try to individualize each treatment and try to figure out what's the best treatment option for each patient.
Yeah, so a lot of contributing factors there. So finally here, how can you help people? What are some of those treatment options there? How do you step in and make a difference?
So it's very unique. So what we look at is we try to break down, hey, how often do you have tension headaches? And how often do you have migraine headaches? And 4 is typically the number. If people have 4 or more migraine days per month, we start talking about prevention meds. We traditionally borrowed from seizure class meds, antidepressant meds, and also blood pressure class meds. It doesn't mean that a provider or another provider, think that they have seizures, depression, or high blood pressure. But, oh, by the way, it also helps for migraine prevention or reduces the frequency of migraines. If those don't work, we have new class of medications that are once-a-month injections, or they're now tablets too, CGRP class, that's also very effective in reducing the frequency and the disability of migraines.
Okay, so not only will you investigate some of those causes, but you also investigate the best possible treatments there. For more information about migraine treatment options at Memorial Healthcare, make sure to visit memorialhealthcare.org, or you can call the number 989-723-1390. Thank you so much.
Thank you.